Hey there, Todd Cameron here, GP and founder at M3 Health. We're looking for two VR GPs very early in their career, PGY 1, 2, 3, and I'll explain why that is in a moment. So unrestricted VR GPs, no locums. We're after permanent GPs that are going to join our local community. We're located, it is M3 Health in Spotswood. We call it Hobsons Bay because that's the more broad area. Spotswood itself has a relatively small population, 2,500 to 3,000, but the catchment, one or two suburbs either side. We go as far as Yarraville, Kingsville, Altona North, and then to Williamstown, of course. It's about 75,000 people in that catchment area, and a really lovely part of Melbourne. Right at the bottom of our street of Hudson's Road that we are on is Graysland and Science Works, so really cool places in the inner west. As you go over the West Gate Bridge, we're down and to the left before you get properly off the bridge. There you go, ABS stats from 2016. Relatively wealthy area, but a very small suburb in itself, and one that's growing. People often make mistakes in their career in general practice, forgetting that it really is a marathon. You're going to be doing general practice most likely for 25 to 30 years and sometimes a lot more. So it's really important to adjust your thinking from the sprint mentality, which can be part of getting through your training, to the long haul and making sure that you start making wise decisions for your career rather than just what's right for the next week or month. And the things you're going to need to think about are choosing the right environment to work in. That means the physical space, that means the community, of course. And in terms of community, capacity to pay, unfortunately, is a very real part of primary care now. With a decade of freezes, even small increases of the MBS are still well behind the inflationary pressures that you will be feeling as an individual. And so the environment you choose is super important to how you succeed. I always say that you need to have three different approaches to general practice. It's like an aeroplane: economy, business, and first class. You should have some skills that are, the breadth of skills. The plane doesn't leave the ground unless the economy class is full, but then you need to start to develop some business class skills that you charge a premium for, and maybe some first class skills that might be skin, that might be inserting IUDs, other skills that may even be talking skills. Doesn't really matter what it is, but you must develop those as a way of building a career rather than just applying day-to-day tactics to what you do. The systems in the workplace that you're in are going to be super important. Things like how you chase down debts, how people make appointments, how well they're consented for the fees, all of these things, recalls, reminders, all of the things that you'd expect are a really important part of success. We take systems and processes really seriously. And lastly, the people. And I'm not suggesting that we have people of the caliber of Barack Obama, but we do have great people. And at the end of the day, we work in a service industry. It's end-to-end people. We don't make any widgets, and so we do need to make sure that we have a really good work environment. We're still conducting ourselves as if we are in a pandemic, so the rooms have HEPA filters. Doctors have access to N95, P2 masks, and staff are all wearing masks as well, and mostly patients are. When I say mostly, pretty well all. Now, choosing a career can really be apples and oranges, and I'm not sure what's the best of these two. Depends on which you need most, but we would like to think that we are ahead of the pack than most. And what I would like to do is talk to you a bit about the environment here. So it's a mixed billing environment. The only people that we bulk bill are kids 5 and under and pensioners at this point in time. Pensioners make up around about 22 to 24% of our patient population in any 1 week. Concession card holders, we charge a discounted rate and then the full rate for all of the rest. 65% retention for all GPs. Doesn't matter if you're part-time or full-time. We don't discriminate here. Previously, we did have different rules for full or part-time, but it is discriminatory, and so the retention for GPs is 65%. Therefore, the service fee is 35% plus GST, as you well know. And we want to make you a risk-free offer. Moving clinics can be a stressful time, but we want to make sure that you don't go backwards. In fact, it's possible to go forwards from the time that you make that commitment. And so what I would like to promise you here is 3 months of $150 per hour. We do that by discounting the service fee that we charge you and a bonus signing on fee of $20,000. No tricks with that. You get $10,000 at your first pay run, $10,000 6 months later. The only requirement is that you stick around for a minimum of 12 months. And at the end of 12 months, you're free to do what you like. We hope that you stick around, obviously, and we're going to make sure that we are working with only the type of doctors that we want to work with. If you left earlier, say you left in 9 months, well, it would just be a pro rata that you need to pay us back. That's it. So no tricks around that. It is genuinely about getting you started in your career in medicine. We think that there is a great opportunity for doctors working 30 hours per week consulting, 45 weeks per year, so 7 weeks a year off. And we know that based on the metrics in this clinic, which is the revenue per encounter of around $90, average patients per hour of about 3.7 to 3.8 patients per hour, that you can generate $300,000 per annum for that amount of work fairly easily, somewhere between 300 and 350 before you pay tax. And we believe that is the minimum that you should be entitled to as a highly qualified professional that you are. This is what the building looks like. This is a specially built facility. Ground floor is being restructured such that there's likely going to be radiology there and some specialty services. Upstairs, we have 16 consulting rooms for the GP clinic and pathology on site as well. Just a nighttime photo. It looks pretty sexy at nighttime. The train goes right past here, so it's actually really good marketing and advertising. You may remember us from early on in the pandemic. We were on a few of the news programs, etc. We went early and hard with pandemic preparedness before it was formally announced that that's what we should do, because safety of our people is paramount. And so these are some of the pictures from the early days. Now this is Spotswood. This is the Westgate Bridge and looking westbound. And if you look to the left here, that's where Graysland is and Science Works. Lovely part of the world, really accessible. As I said, we have a train stop right out the front. So if you want to come by public transport, pretty easy. Few of the GPs cycle to work as well. Very accessible. So here's an invitation to apply. I only have 2 of these offers available. Once they're gone, they're gone. We probably won't offer them again, and we want people that can start in the next 4 to 6 weeks. So pretty quickly would be ideal. Yes, there is enough work, and the risk is on us to make sure that you get busy. Here's 2 contact forms for me. I'd love you to send me a CV to tcameron@m3health.com.au. That is my real email address. And please text me your name and what's most important to you about your career in general practice. If you haven't texted me before, this is my mobile number, 0416 265 900. Use those contact details appropriately. I look forward to hearing from you. And as I said, once the 2 are gone, they're gone. And at this point in time, it's PG 1 to 3 only. If you're outside of that, please be clear about that. And we probably aren't taking any others on. Cheers. Hope you go well. Bye.